Mr. Cruz. My name is Tiffany. I will be your student nurse completing your physical examination today. Can you go ahead and tell me your full name and age, please?
Nicholas Jeffrey Cruz, age 38.
Okay. Mr. Cruz is alert and oriented ×3. His posture is he is sitting upright. He appears to be well nourished. There are no abnormalities noted. He is cheerful, smiling. Speech is clear and concise, and he appears to be well groomed. Mr. Cruz, we're going to start the physical examination by just looking at your skin. Skin appears to be pink, some moderate dryness on his hands and knees, but no other obvious abnormalities are noted. Now, Mr. Cruz, I'm going to go ahead and take a look at your face. The face is symmetrical. Cranial nerve 7 is intact. I'm going to go ahead and palpate if there are any lump lesions or abnormalities. Okay, and none are noted. Mr. Cruz, can you go ahead and clench your teeth for me? Thank you. Patient's face is still midline. Cranial nerve 5 is intact. And Mr. Cruz, can you stick out your tongue? Okay, Mr. Cruz's tongue is midline, no deviation noted. Cranial nerve 12 is intact. Alright, Mr. Cruz, I'm going to go ahead and palpate your sinuses. If you can tell me if there's any pain or tenderness noted.
Okay. No.
Okay, no pain, tenderness, or bogginess is noted. Thank you. Now, Mr. Cruz, I'm going to go ahead and take a look at your eyelashes, eyelids, and eyebrows. Hair is dispersed evenly. Eyes are equal bilaterally. No deformities, lesions noted. Now, Mr. Cruz, I'm going to go ahead and take a look at your eyes. I'm going to open them up here. Thank you. Looking at the conjunctiva, sclera, cornea, and irises. There is no redness, irritation, or drainage noted. Patient has hazel-colored eyes, and pupils are at a +3. Thank you very much. Now, Mr. Cruz, if you could just look straight ahead for me, please. And then look over towards the couch and then back at the pen light. Thank you very much. Mr. Cruz's pupils are equal, round, and reactive to light, both directly, consensually, and on accommodation. Now just look straight ahead. Okay, Mr. Cruz's cornea reflex, light reflex is present bilaterally. Now, Mr. Cruz, I'm going to have you take a look at the pen light. I want you to follow it with your eye without moving your head. Okay, I can insert in that Mr. Cruz can follow the pen light with his eyes. Now, Mr. Cruz, I'm going to have you go ahead, cover one eye, and read that for me, please.
Happy hippo, angry duck.
Now the other eye, please.
Happy hippo, angry duck.
Thank you very much. Nearsightedness is intact. Now, Mr. Cruz, I'm going to go ahead and take a look at your ears. Okay. Mr. Cruz does have some Darwin debuncles on the helix, but no other abnormalities noted. I'm going to palpate the auricle and the targus. Tell me if there's any pain or tenderness.
No.
Okay, no pain, tenderness, or abnormalities noted. Alright, I'm going to take a look at your nose. Nose is midline. I'm going to palpate. Can you tell me if there's any pain or tenderness?
No.
Okay, no pain or tenderness noted. Can you go and put your finger on one nostril for me, please, and take a breath? Other side, please. Okay, nares appear to be patent bilaterally. Now, Mr. Cruz, I'm going to take a look at your mouth. You can go ahead. Thank you. Oral mucosa is pink and intact. No lesions or abnormalities noted. Teeth are intact. Tonsils are present at +1. Can you say ah for me, Mr. Cruz?
Ah.
Uvula is midline. No swelling or abnormalities noted. Now I'm going to go ahead and take a look at your neck. No deformities noted. Now, Mr. Cruz, can you go ahead? I'm going to have you put your head up and down, and then side to side, and then rotate. Mr. Cruz has full range of motion of his neck. Now I'm going to place my hands on top of your shoulders. If you could try to lift them up, please. Okay, cranial nerve 11 is intact. Now, Mr. Cruz, I'm going to palpate your lymph nodes. You can tell me if there's any pain or tenderness. Start at the pre-auricle,
No.
post-auricle,
No.
occipital,
No.
okay, posterior cervical,
No.
anterior cervical,
No.
tonsilicular,
No.
submandibular,
No.
submental,
No.
and then subclavicular.
No.
Okay, there's no pain or tenderness noted, no swollen lymph nodes. Alright, I'm going to go ahead and take a look at the carotid artery. If you can put your chin up for me, please. Thank you. There is no pulsation noted. I'm going to go ahead and palpate the carotid.
No.
Now the other side. Okay, carotid artery pulse is equal +2 bilaterally. Now I'm going to inspect the trachea. No abnormalities noted. I'm going to go ahead and palpate. Put your neck up for me. Thank you. Other side. Okay. No lumps noted. No deformities. Alright, Mr. Cruz, I'm going to have you go ahead and turn around for me, please. I'm going to take a look at the posterior chest. Mr. Cruz does have some freckling, some moles that are smooth, less than 1 centimeter with equal borders. He does have a scar over on his right shoulder and a scar over on the right upper or lower neck. Mr. Cruz, I'm going to have you take a deep breath for me, please. Chest expansion is equal bilaterally. Now using the palmer of my fingers, I'm going to need you to say 99 for me.
99. 99. 99. 99. 99. 99.
Okay, tactile primitus is present bilaterally. Now I'm going to percuss the lung areas. Okay, and renaissance is heard bilaterally. I'm going to go ahead and palpate and percuss the CVS. Any pain or tenderness?
No.
Okay, no pain or tenderness noted on the CVS. Alright, so I'm going to go ahead and listen to your breath sounds. Alright, if you could just take a deep breath for me. Okay, breath sounds are clear and present bilaterally. Alright, sir, I'm going to have you turn around for me, please. Thank you. I'm going to inspect the anterior chest. There's no deformities noted. Equal rise and fall. Breathing is unlabored. I'm going to go ahead and auscultate the breath sounds. Deep breath, please. Breast sounds are present bilaterally and they are clear. I'm going to go ahead and assess the pericardium. There are no heaves or lifts noticed. I'm going to locate the PMI going by the midclavicular to about the 4th, 5th intercostal space. Okay, PMI is about 2 plus. I'm going to palpate for any thrills or lifts. And none are noted. I'm going to go ahead and have you lay back, sir. Going to auscultate heart sounds, starting at the aortic. Pulmonic. Erb's point. Tricuspid. And the mitral. Okay, and then with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral, okay. S1 and S2 is heard, no abnormal heart sounds, no murmurs, pulse is at 80 within normal range. Alright, now I'm going to take a look at the upper extremities. You feel your shoulders. Skin is warm and dry. Papillary refill is less than 3. Radial pulses are pleasant, +2. Alright, Mr. Cruz, can you go ahead and put your arms out to the side for me and then put them above your head? Okay, Mr. Cruz has full range of motion of his shoulders. Thank you. Now I'm going to go ahead and inspect the abdomen. There are no abnormalities noted. I'm going to auscultate the bowel sounds starting in the right lower quadrant. Bowel sounds are present in all 4 quadrants. They are normal activity. I'm going to auscultate the aortic. And no breweries noted. Okay, I'm going to percuss the abdomen. Okay, and tympany is heard. I'm going to go ahead and palpate Mr. Cruz to me if there's any pain or tenderness.
No. Nope.
Okay, No deep palpation.
No.
Okay, there are no abnormalities palpated and no masses. Alright, I'm going to go ahead and take a look at your legs. Color is normal for a patient. I'm going to feel the dorsal pedis. Okay, it's present bilaterally at a +2. And posterior tibia. And then is also present bilaterally at a 2+. Alright, Mr. Cruz, I'm going to have you bring your legs up to your chest. Thank you. If you put them straight, please. And put one out to the side and bring it back. Thank you. Other to the side. Bring it back. Alright, thank you. I'm going to go ahead and have you sit up for me, please. Alright, Mr. Cruz, I'm going to have you close your eyes. And I need to tell you to tell me on what side do you feel the cotton ball.
Left cheek. Right cheek. Right bicep. Left bicep. Left hand. Right thigh. Left shin.
Okay, Mr. Cruz's tactile sensation is intact. Alright, Mr. Cruz, I'm going to have you put your hands forward and we're going to flip them up and back as fast as you can. Okay, Mr. Cruz's RAM is intact. Now I need you to go ahead and take your heel. Sit down, please. Take your heel to your knee and go all the way down. Other side. Heel to knee, all the way down. Alright, thank you. We're going to check your reflexes. Thank you. Now other side, please. Thank you. And I'm just going to take your leg. Okay, other side, please. Alright, you can lift your foot up for me. Other side. Okay, plantar reflex is intact. Alright, Mr. Cruz, I'm going to go ahead and have you stand up. I'm going to have you walk forward. Thank you. Now I need you to walk back with tandem, foot to foot. Okay, thank you. You can turn around. I need you to close your eyes. We're going to do the Romberg test and then touch your finger to your nose. Other finger. Thank you. I'm going to have you bend down and touch your toes for me. Okay, and then go side to side. Alright, Mr. Cruz has full range of motion. Thank you. Our physical assessment is complete.
Thank you.